Good evening, everyone. Welcome to our MS Path to Care webinar. My name is Brian Thompson. I'm the Programs Manager for Can Do MS, and I'm here at our offices in Colorado, and we're joined by Roz in Maine and Stephanie in Virginia, and wherever you are, we're really happy you can join us here. We hope you're having a great Tuesday, and we really appreciate you being here for this important conversation on finding and partnering with your healthcare team. This is part one of a three-part special webinar series that we're bringing to you in partnership with the Society of Participatory Medicine and Sanofi Genzyme as part of MS Path to Care. For those of you who are new to Can Do MS, for over 30 years, we've been delivering health and wellness education programs to help families with MS thrive. So please visit our website, which is cando-ms.org, to learn more about some of our great programs, including our monthly webinar series. We also encourage you to take advantage of the great resources that the Society for Participatory Medicine and Sanofi Genzyme has to offer. It's been great working with them to develop this new initiative called MS Path to Care. The goal of MS Path to Care is to provide resources that empower people affected by MS to be active partners in their healthcare experience. By focusing on shared decision-making, MS Path to Care helps people with MS and their support partners work collaboratively as a team to discover and navigate the path that works best for you. So visit the Path to Care website, which is mspath2care.com, to learn more. And again, one of the major initiatives in MS Path to Care is this very special three-part webinar series. Each of these webinars will cover a different aspect of shared decision-making. Tonight's program is on finding and partnering with your healthcare team. So hopefully you've logged on to GoToWebinar, and if you are having issues, you can call their support line, which is 877-582-7011, and they will be happy to help you with any technical questions. We encourage you to be an active participant in tonight's discussion. We'll save about 15 minutes at the end for questions and answers. You can submit your questions anonymously on your screen. There should be a rectangle. At the bottom of the rectangle is a box that says questions. You can enter your question in right there, and we'll try to get to as many questions as time allows. If we don't get to your questions, I will tell you about other opportunities that you can submit questions to Can Do MS, and hopefully we can get answers to them. One more important note before we get started. We understand that we are providing a lot of information tonight that may be overwhelming. The program will be archived, and you will receive an email with all the slides, and you can go back and hear any information that you may miss. The attachment for the PDF copies of the slide are on the bottom of that rectangle. It says handouts. That also has two infographics about tonight's topic that Roz and Stephanie helped to create. So please take advantage of those resources. Without further ado, it's my pleasure to introduce our speakers tonight. We have first Stephanie Buxhoeveden, who started her career as a neurological ICU nurse before going back to school to pursue her master's degree. About a year into her program, she was hospitalized with weakness and blurred vision and was eventually diagnosed with relapsing remitting MS. Her doctors advised her to pick a less demanding career, but she pushed forward and became an MS certified nurse. Stephanie began working in the same MS center where she was a patient and soon found a unique opportunity to have a positive impact on the lives of others living with MS. Stephanie now works as a neurology nurse practitioner and is the co-director of an MS comprehensive care center in Fredericksburg, Virginia. She is also a PhD candidate at Virginia Commonwealth University, where she is studying the use of biomarkers in MS. And we also have Dr. Roz Kalb, who is a clinical psychologist that has specialized in MS care, support, and education for over 30 years. After earning her doctorate from Fordham University, she began her career in MS providing therapy at Albert Einstein College of Medicine and MS Comprehensive Care Center in New York. Dr. Kalb joined the National MS Society in 2000, creating online resources for families living with MS and healthcare professionals. Roz has written several renowned books and articles on multiple sclerosis and has been on the Can Do MS faculty since 2001. Roz continues her resource development work as a consultant for the MS Society and as a programs consulting coordinator for Can Do MS. So again, thank you all so much for being here and taking the time to register and your initiative for joining us tonight. And I will now turn things over to Roz and Stephanie.
I'm very glad that you have joined Stephanie and me tonight to talk about this important topic of how to find and partner with your healthcare team. We're going to enjoy bringing this information to you and engaging in conversations with you about questions or challenges you have as you work with your healthcare team. So for our learning objectives for tonight, so Steph and I are going to walk you through a couple of real life scenarios, and we hope that all of you, people living with MS and support partners, are going to leave with a better understanding of why a comprehensive team approach is most effective when a person is trying to manage the unique, unpredictable, and changeable needs that occur in MS. Stephanie's going to help you identify the members of a healthcare team, what they can do for you at different points along the way, and how they fit into the big picture of comprehensive care. We want to help you build strategies for assembling this team, no matter where in the country you may live, and how to communicate with the members of the team and help them work together to help you thrive and manage your MS. And we want to give you ways to utilize that team effectively when and if you need them, and make the most of your office visits with them. And with that, we'll move on. So we talk about team and we talk about comprehensive care, but I think it's important for you to understand why the team concept is so important to MS care and why it's such an important part of the Can Do MS philosophy and the MS Path to Care modules that we've been developing. As all of you know, we don't need to tell you this, MS affects each person very differently. If you're in a room full of people with MS and you look to the right or the left, nobody is exactly the same. Nobody has exactly the same needs. And not only are the person's needs unique, but they change from week to week or month to month, and certainly over the course of years, which means that over the course of the disease, MS can cause a lot of different kinds of symptoms, different for every individual, but also different in when they appear, how severe they may be, how they may come and go, and all of these changeable symptoms impact daily life. So among the most common symptoms that we see are changes in cognition, meaning a person's ability to think and process information and remember things. Mobility problems, which are probably the most visible and apparent symptoms that a person experiences, whether those mobility problems are caused by weakness, stiffness or spasticity, balance problems, or whatever. Vision problems, which are often the first symptom of multiple sclerosis, where people experience blurred vision or double vision or pain in the eye caused by optic neuritis. Certainly pain and other sensory problems like numbness and tingling are common in MS. And emotional changes, most commonly depression and anxiety, which we know are extremely common in MS, as they are symptoms of the disease as well as reactions to all the challenges we've just been talking about. And bladder and bowel problems are common. So we're going to learn why the team can work with you to help you manage this great array of symptoms if and when you experience them.
And, you know, when I was diagnosed with MS, it was incredibly overwhelming to find a specialist, to know how to plug into resources, to know where to turn to for information. And I was a healthcare provider. So one of the things I'm really passionate about is helping people plug into resources both at the time of diagnosis and then throughout your MS journey, because those needs are going to change year to year, day to day even. So we brought this visual for you, and the most important thing to notice is in the middle is you and your support team, whoever that is for you, whether that's friends, family, other people with MS, you're the core of the team. And then everybody with MS should have their core healthcare team. So that's going to include your MS nurse, a nurse practitioner, a physician's assistant, a neurologist, and hopefully if you have some sort of access to a MS specialist, that's even better. And then of course primary care, because primary care is absolutely essential. And then on the outside here, we have a whole array of different specialists, from physical therapy to occupational therapy, to mental health, to pharmacy. And we're going to kind of go into a lot of those different specialties and give you examples of what they can help you with, what kinds of symptoms they can help you control. But this looks like a lot, right? There are a lot of dots here, and there are a lot of specialists that we've named. And so just to be clear, I know this looks overwhelming, but not everybody with MS is going to need all of these specialists. We're just here to tell you that they're out there and that they can help you, and to give you some examples. And you might need a specialist for a short period of time, such as physical therapy after a relapse, but that doesn't mean you're always going to be seeing a physical therapist throughout your MS journey.
So you mentioned both a neurologist and the primary care physician. So could you just talk briefly about why it's so important for people to have both of those on their core team?
Absolutely. So all of my MS patients need to have primary care, because MS unfortunately doesn't protect you against having other health concerns. So they're your number one person who's going to help you prevent other illnesses such as diabetes, high blood pressure, high cholesterol. Those are all things that I don't look for and I don't check for. So it's really important for your overall health, which impacts your MS. And it's also really important to have somebody that you can get into if you're having an acute issue. So we all know how bad we feel if we get a cold or the flu or stomach virus. It's really important to have somebody there who can get you through it and who can offer you supportive care in that time of crisis. And another really common issue is I often use primary care providers to do urinalysis. So if you're feeling bad or your symptoms are flaring, or if you're having a new symptom, often we are suspicious of a UTI, and I'll use primary care because people can get in quicker and get the test done faster. So it's really important for me to have that point of care, and I try to be as collaborative as I can with my primary care physicians in my area when they're working with my patients. So the first thing we're going to do is we're going to talk about Kelsey. Kelsey is a 28-year-old teacher who was diagnosed with relapsing remitting MS a year ago after an episode of optic neuritis. She's currently taking oral MS therapy, but wants to start a family. And she's working as a teacher, but fatigue, vision problems, and bladder frequency periodically interfere with her work. Kelsey and her husband, Ted, have also had difficulty coping with this major change in their lives. So Kelsey has a neurologist. What other members of the team would you like her to see next? So I see a lot of you picked up on the fact that she probably is having some difficulty coping and needs to talk to somebody, and family planning is very important to her too, and obviously occupational therapy, urology, and ophthalmology, all good choices. So we're going to walk through a couple suggestions that we had. Roz, I was hoping we could start by talking about her coping.
Absolutely. So, I think that both Kelsey and her husband, Ted, have had an unexpected change in their lives that neither of them anticipated. And when a young couple, the start of their professional life, starting a family, maybe towards the beginning of their relationship, suddenly have to cope with this intrusion in their lives, it takes both of them a while to get back on their feet. There may be some shock, anxiety about this, certainly sadness that they're suddenly having to deal with a chronic illness, and also I think some healthy grieving, just because the life that they had embarked on and they had pictured so clearly in their minds when they got together, it's sort of hit a little bit of an obstacle. And before they can begin to figure out their next step and how they're going to manage this, they may need to just be sad together a little bit that they're having to do this. A mental health professional can be very helpful. So I was pleased to see that so many of you wanted Kelsey and Ted to get that help at the beginning. They need to figure out how this might impact Kelsey's work as a teacher and her ability to continue doing that which she loves. They also need to be able to talk comfortably about what MS might mean for their future and also for their decisions about having a family. Now, the good news is we know that women with MS can have healthy, happy babies, and that there is no negative impact on a woman's MS having a child. But that being said, I think that couples still need to be able to think through, okay, how is this having a baby going to fit into their lives now? How do they need to talk with their healthcare team about the medication that Kelsey is taking? And how might they plan for the unpredictability of a chronic illness like MS in terms of being parents and having a family and careers at this point in their lives? It's not that there are right or wrong answers. It's that sometimes it's helpful to have a mental health professional just to help you have those conversations in an open and honest way, sharing concerns, problem solving together, and coming up with a plan that works for both Kelsey and Ted.
Yeah, absolutely. And I love how you brought up the fact that she loves teaching, because I think one of the things that people might not necessarily turn to their neurology team first is career advice. And that's something that I talk about with a lot of my patients, right? We talk about, especially my young ones, their goals, because often this is the time of life when you're either starting your career or in school still, because we most frequently diagnose MS in somebody's 20s or 30s, right? So this is something that's on the forefront of a lot of people's minds. And certainly a key part of your team goals will be to help you manage those symptoms so that you can continue to work or you can continue to be as effective as you can be. So me as a neurologist, somebody who works with MS, we often talk about FMLA or accommodations that you might need in the workplace to keep doing your job effectively. And your neurologist is going to be your go-to person to help you with those recommendations. Sometimes I will bring in occupational therapy, for instance, for her fatigue. Occupational therapy can help work with you and find ways throughout the day that you can spare some energy so that you're not getting burned out by 11 a.m., right? So you're able to be more effective for longer throughout the day. And that's one really useful thing that I refer people to occupational therapy for. And her bladder frequency. It's tough to be a teacher and stand up in front of a classroom if you need to use the bathroom every 30 minutes. So it's obviously a top priority to get her to a urologist so that we can manage those. And your MS nurse is also a really good person to turn to for some bladder management strategies, right? So we can talk to you about hydration. We can talk to you about timing when you're urinating. There's a lot of really simple lifestyle things that we can try before we have to turn to medicine. And same with ophthalmology with her visual symptoms, especially after optic neuritis. There's a lot of things that we can do to compensate for your symptoms, and that should be something that's watched at least yearly and to make sure that things are still stable and looking good. And then I kind of already touched on the visual problems. Again, neurology and ophthalmology, it's important to get you regular exams and communicate about what symptoms you're having. Now with family planning, yes, your neurology team is very important because we need to know the plan, right? Because if she's taking an oral therapy, we're going to have to discuss when to stop it before she starts trying to conceive. And so the timing is different based on what medication you're on. So that's something you have to go in with a very clear understanding of. And then your OBGYN should also be aware. People with MS are not high-risk pregnancies. But it's obviously important for your OBGYN to be clued in because of the disease-modifying therapies, and often a lot of the medications we use to manage symptoms have to be stopped or held during pregnancy and sometimes even before conception. But obviously, family planning is so much more than just neurology and OBGYN, right, Roz?
So I'm glad that you brought up the issue of stopping medications, because I think one of the issues that many young couples face is they may not be in agreement about what the priorities are. So just as an example, a woman might be very eager to get pregnant, start her family, or add to her family, even though it might mean going off her medications for a significant period of time. Her spouse, on the other hand, might find that very frightening and might say, well, I don't want you to come off your medications. I'm too worried about what might happen if you're not on your medication while we try to get pregnant and while you are pregnant. And so being able to have conversations about that, I think, is critically important, because each person's goals and fears need to be taken into account. And that's why the mental health professional can help those conversations happen.
That's something I see all the time. So really good point. Now we're going to talk a little bit about assembling your healthcare team.
So I'm going to start here because we really want Kelsey and Ted both to have the benefits of working with the entire team. So we've already talked a little bit about what the mental health professional's role is, and certainly adapting to MS is not something that you do just once when the diagnosis happens. Adapting needs to recur every time the disease creates a new symptom or a new challenge, or makes it difficult for you to do something that you've done very easily and successfully in the past. You have to kind of stop, take stock of what's happening, and adapt to whatever the new normal is. And that's something that mental health professionals can help individuals and couples do as needed over the course of the disease. In my career, we often refer to this as intermittent psychological support. It's just having somebody there to accompany you during times of transition or challenging times. Mood issues are very common in MS. We know that more than half of people with MS are going to experience significant depression at some point along the way, as well as anxiety, which is equally common in MS. And we now know that these emotional changes are so common because they are part of the disease process itself, probably related to the inflammatory process that happens in the body with MS. So in addition to being sad or depressed or anxious about the unpredictability of a chronic illness, it's actually a symptom just like any of the other symptoms that Stephanie's talked about. And these mood changes are as deserving of attention as any other symptom of MS, so there's no reason to be embarrassed about them or hide them. They need attention so that you can get the help you need. It's hard enough to deal with a chronic illness without trying to do it while you're very depressed or very anxious. And as we've talked about, sometimes the mental health professional is needed just to help if there are stresses in the relationship or different priorities that couples need to talk through. And sometimes just learning how to talk openly and comfortably with one another is a major challenge. And certainly the mental health professional can help with that.
Yeah, I think that's a really good point. And especially when I'm in a visit with someone and there's so much to get through, right? We have to talk about your medication, we have to talk about your symptoms, we have to talk about your work life, your home life, family planning. And I think mental health is sometimes, unfortunately, something that gets overlooked a little bit. And oftentimes I'm surprised when I do finally get my patients to see a mental health provider, what kind of information comes out and comes back to me. And that's when I think it's really rewarding to see the benefits of that whole team, and each of us brings such a different perspective. And I think it really brings a better quality of care to people.
So now that we've talked through how we might want to help Kelsey and Ted, we want to introduce you to Andrew. Andrew is 47 years old. He's an IT professional who's now divorced, and he has secondary progressive MS. He was diagnosed 7 years ago, and prior to that, he is already working with his primary care doctor on trying to get his weight under control and manage his cholesterol, which had gotten elevated. But because he's had mobility issues, difficulty getting around because of his MS, and weakness and stiffness that are some of his prominent symptoms, Andrew had stopped exercising. And so the weight that he'd managed to lose, he gained back because he was no longer able to be as active. And recently, Andrew received his first negative evaluation at work. His manager said he just wasn't being as productive. He seemed to be having memory issues that were causing him to forget assignments and get things confused that he needed to be able to keep straight in order to be effective at his job. And he just didn't seem to be able to pay attention in meetings and during conversations. And lastly, because of Andrew's reduced mobility and the fact that he's not exercising anymore, he's become very uncomfortable with increased constipation. So Andrew has a lot going on that we need to help him manage. So Andrew has a neurologist that he's been working with. Which other member of the team would you like Andrew? We seem to be having difficulty with names tonight. Which other member of the team would you like Andrew to see next? Well, clearly people think that the physical therapist is top priority, so everybody is recognizing the importance of helping Andrew get back into an exercise routine that meets his needs, because if he's able to do that, then some of the gastro issues that he's having may take care of themselves. And the dietitian can also help him manage his diet and take control of his weight and cholesterol. But I'm also glad to see that many of you have suggested that a neuropsychologist or some other cognition specialist would be helpful here to see if we can find out what's interfering with Andrew's functioning at work, because we don't want him to lose his job.
And as Roz mentioned, that's the overall health thing that we were talking about earlier, right? Because as MS symptoms progress, then we tend to become less active. And as we become less active, we tend to put on weight. Our cholesterol might go up. Our blood pressure might go up. We start getting these what we call comorbidities that can also worsen MS. And all of these can lead to increased fatigue, constipation, more difficulty with cognition. And then the more fatigued you are, the less you're exercising. And you get into this vicious loop, right? So we have to break you out of that cycle. And primary care is absolutely key for that, as is dietary and physical therapy, right? So it's hard sometimes, especially when you're dealing with a new symptom or if your MS has progressed and you're no longer really confident in what you can do physically, right? And it's tough to find an exercise routine that's safe and that's challenging and that helps you with your spasticity and helps you with your muscle weakness. And the physical therapy is really a good place to start, because they're going to work with you to find your limits, to push you a little bit, and will help you manage that fatigue. And in time, if we get all of those things back on track, you'll start seeing the other symptoms improving as well. And so with the mobility problems too, in addition to physical therapy, your neurology team is very important, right? So a lot of what I do is assess whether my patients are safe and whether they could need an assistive device. And that's something that, you know, we do have to talk about, especially in people like Andrew who have secondary progressive and who are having more trouble getting around, right? He has a lot of spasticity. So I'm definitely going to work with him on managing that spasticity more effectively. And sometimes that means exercise, and sometimes that means medication. There are even injections that we can give for spasticity. And there are a lot of devices that we can recommend. And so I can plug Andrew into physical therapy and even physiatry to help him identify tools that might help him a little bit more. And like we mentioned with constipation, we are going to definitely manage that from a neurology standpoint. I think in Andrew's case, a lot of it does come down to exercise and diet, but we can also be causing it with a lot of the medications we give people, right? So a lot of the medications for pain, for instance, can lead to spasticity. Same thing with bladder. They tend to dry you out, and their major side effect is constipation. So I'm definitely going to look at Andrew's medication list and see if maybe we could be causing a little bit of that issue, and whether we can make some simple medication changes that would make a huge difference. And nursing too, again, same thing with the bladder issues, right? So nurses are key in teaching you lifestyle strategies. It's the same thing. There are lots of lifestyle strategies, including timing and things to get you back on track to being more regular. And then when all else fails, we can also get you over to a gastroenterologist who can get deeper into what the issue is and what interventions we can play. But I think one of Andrew's major concerns too, in addition to his physical issues, are his cognitive changes.
So before I talk about Andrew's cognitive changes, though, Steph, I just wanted to ask you one question. I think you mentioned before about the comorbidities that Andrew has and how they might worsen MS. Could you just say a little bit more about what we know about the relationship between comorbidities and MS?
Absolutely. And like I said before, unfortunately, MS does not exempt us from having other medical issues. So it's really important to stay on top of your overall health, because we know other comorbidities like high blood pressure, cardiovascular disease, and diabetes all do accelerate the progression of MS and put you at a higher risk for becoming more disabled down the line. So the most important thing we can do is try to prevent those. But if you already have a couple of comorbidities, it's really important to control them well, because if you control them well, often they don't have that negative impact.
Great, thanks. So we now know that more than 65% of people with MS are going to experience some cognitive changes. So Andrew is by no means alone here. But one of the first things we're going to do with somebody like Andrew, who seems to be having cognitive changes at work, is we're going to evaluate him for depression, because we know that depression is also very common. And if it turns out that Andrew is depressed at this time and we're able to treat that depression, some of his cognitive changes may actually get better, because depression changes people's thinking. And we want to make sure that that's not contributing to whatever's happening. So once we've evaluated Andrew for depression and treated it, if we find it, then we need to look and see what kinds of changes in memory and thinking he might be having that are interfering with his daily functioning. So the most common changes that happen in MS are, first and foremost, the ability to process incoming information. That slowing of information processing is the most common change. And that can affect all of the other cognitive functions like memory and learning, the ability to pay attention, the ability to focus, take in the facts and make good sound decisions based on those facts. Because if you're not processing information adequately, all of those things become more difficult. So we can evaluate Andrew and find out in what areas he might be having difficulty. But equally important, we want to find out what his cognitive strengths are. Because the way we can help Andrew succeed in his daily life, at work and at home, with cognitive changes, is to give him some compensatory strategies, different ways to do things, or workarounds. We don't have any magic pill that improves cognition. So instead, we need to give people tools and strategies. So for example, if he's having trouble remembering things, keeping track of assignments, we want to help him be more organized so that he's not relying on memory in order to keep track of things. We want to give him tools for how to participate effectively in a meeting so that he can manage the conversations going on around him. So whatever strategies he needs, that evaluation will help us figure out what those are. And there are cognitive rehabilitation specialists, including neuropsychologists, speech language pathologists, occupational therapists, who can help Andrew depending on what's available in his community. He can find somebody to help him manage his cognitive challenges at work before he runs into even more difficulty. So we've talked a lot about the healthcare professionals who can help you. But the obvious next question is, well, how do I find these people? I don't even know if there are any in my community. Well, ideally, everybody would go to what we call a comprehensive MS center. At a center like that, all of these different disciplines or clinicians either work together on a single team in a single place, or they might be on a campus where you can get to all of those different clinicians easily, or they're a network of people within a community who do collaborate with one another to provide comprehensive care. If that kind of center isn't available, then people are left to find those individuals on their own. So they might be referred by the primary care physician or their neurologist. So you might have a neurologist who says, I want you to see a physical therapist to get an exercise routine going, or I want you to see a psychologist for some help with mood issues you're having, and here are the names of people that you can contact. You can also call the National MS Society at this magic number on the screen and talk to an MS navigator who can identify some of these professionals in your community. An insurance company's webpage will also list covered providers. So if you know who your insurance provider is and you go and check it out, you may find those disciplines listed by your healthcare plan. And you may get very good recommendations from other people with MS, people you meet in a local self-help group or at other MS activities, and those referrals can be extremely helpful.
Yeah, and I think I just want to reiterate that it's not always as simple as just reaching out to one person, right? So there are a lot of barriers to this, and Roz mentioned the geographic barriers, the availability depending on your insurance company and who they participate in. But we also recognize that having a team of 5 or 6 people is time consuming, right? It's incredibly time consuming to get to a lot of different specialties. You have to pay copays at each office, especially things like physical therapy that adds up if you're going several times a week. So a lot of my patients are hesitant when I refer them to a bunch of people. And the thing that I say is at least go for a consultation and speak to the provider and speak to the specialist and voice your concerns and say, I just don't have time to come see you 3 times a week. What schedule could we make around my work schedule and around my life that could be a little bit more feasible? So it doesn't always have to be this big time consuming thing. And even if you go one time or a few times just to get the tools that you need, it can make a tremendous difference.
And also, I think, you need to like and trust the person that you're seeing. And so sometimes it won't be the first mental health professional you get referred to or the first physical therapist. You may actually need to take a little time and trial and error to find the person you really are comfortable partnering with, because this is a partnership. And so you may need to try more than one of these folks before you find that partner.
Yeah, and to Roz's point, that can take time, because I'm sure all of you are familiar with, you find this great neurologist that you hear really good things about, and you call and you make that appointment and you're so excited, and they say, all right, we'll get you in 4 months, right? So a lot of specialists are like that, right? We have long waiting lists, and it's unfortunate, but it's the reality for many of us. So if a patient says to me like, yeah, I'm having these bladder symptoms, and yeah, it's really limiting my ability to work, but I'm a little embarrassed about going and seeing a urologist, I always encourage them to make the appointment, because chances are good that you're probably going to wait 3 months to get in for that appointment. And what you don't want to happen is you don't want to get to the point where your bladder symptoms are so bad that you're thinking that you can't work anymore, and then at that point you go make the appointment and you're put on a 3-month waiting list, right? It's always better to get your foot in the door, even if you go for one consultation and you don't see that person for another year. At least you're established there, so that when you call, you can get in a little bit sooner, a little bit easier, so you don't get into this crisis mode where you're scrambling, right?
You sort of want your team members in your back pocket, in other words, so that or in your tool chest. So you may not need them right away, but if you've been referred, as Steph says, then they know you're in their system. And if something does come up and you really need help, you've already made that contact. That's very reassuring to know that they're there if and when you need them.
Absolutely, absolutely. So now that we talked about how to assemble your team and the process of getting in to see these specialists, how do you make the most of that office visit? So a lot of the times you're waiting a really long time to get in to see someone, and when you get there, time is precious. So there's a lot of things that you can do ahead of time before your visit to make sure that you're really getting the most out of your time. I always encourage people to make a list of questions and issues and keep that list somewhere easy on your refrigerator, and as things pop up, just jot it down. Ask Stephanie about my spasticity, or ask Stephanie about my fatigue, and just have a priority list. And then at the beginning of your visit, you can give that to your doctor. And same thing with your current medications. Always know what you're on, always know the doses that you're on, and which medications need to be refilled, because I can't tell you how many calls I get a day where I see a patient and they get home, they go, I forgot to ask you to refill my gabapentin. So it saves you an extra phone call and just helps you to be prepared. And also, as we've been talking about, cognition is a big problem with a lot of my patients, and it's just overwhelming, right? A lot of us feel anxious during these visits, and there's a short period of time to go over a lot of information, and so it's always good to bring reinforcements. If you have friends or family that can come with you, 2 sets of ears are better than 1. You're going to retain more information between the 2 of you, and take notes. And even if that's not something that's easy for you to do, you can ask if it's okay to record the visit. And most providers will be okay with that and be open to that, but that's something you definitely want to check ahead of time if they are okay with it. And then during your visit, it's really important to arrive early. And I know that a lot of you are going, well, I wait in the waiting room for an hour. Why do I have to be early when they're always running behind? That's not always the case. And if you show up like right at the time of your appointment, people don't realize that the first 20 minutes that you're sitting in the waiting room is the front office staff updating your insurance and updating your paperwork before I can get the chart and bring you back to the room. So getting to your appointment 10, 15 minutes early lets the administrative stuff get out of the way so that by the time your appointment time rolls around, you're ready to go in with the provider and you have the maximum amount of time. If you're late to your appointments, again, that cuts into the amount of time that you're going to be able to sit with your staff and with your providers. And ask questions. If I am babbling at you in jargon that you don't understand and I'm talking too fast and you're trying to write notes and you're not catching things that I say, just interrupt me, ask questions. You should understand what's going on with your health, right? Because this is something that you're with for life, right? You have MS and it's not going anywhere, and you need to understand what's happening with your health and with your body. And if you don't understand that, you need to be pushing the pause button and asking questions. So do not be bashful, which I know, again, is a big issue, right, Roz? Because I know a lot of people go to mental health professionals and all these issues come to light, and I'm kind of over there like, well, they never mentioned that to me. What is going on?
So in the course of my career, I sat with a lot of people who told me about symptoms they were having, problems with their bladder or their bowel, or with sexual intimacy issues or pain. And I was working in a comprehensive care center. And I said, well, did you mention that to the neurologist? And I heard everything from, I couldn't talk to him about that, to, well, I didn't want to bother him, to, I didn't want him to be disappointed in me or think I was a complainer, or. And all I can tell you is that there's really nothing that you can bring up with your MS provider that he or she has not heard before. If you're not sure that a symptom that's troubling you is related to your MS, ask, and your MS provider will tell you, yes, that's related to your MS, or it's not. But certainly these issues, particularly the private ones, bladder, bowel, sexual intimacy, mood, cognition, these are important to your quality of life. So don't deprive yourself of the opportunity to get help because you're feeling a little bashful about them. Speak up. And if you find a provider who isn't able or willing to discuss any of these with you, that's when it's time to find a different provider.
Yeah, and it's all about finding who you're comfortable with, right? So I'm the first female provider in my practice, and now all of a sudden all of our MS patients have bladder issues and sexual dysfunction that they've never talked to any of the male providers about. So, you know, if that's the case with you, if you have a provider of a different gender and you're just not comfortable talking about it, talk to your MS nurse. MS nurses are incredibly approachable. This is what they do day in and day out. And if you're feeling like your provider isn't as approachable or as open to discussing these symptoms, often nurses can help you with that management and help you break the ice and break down the situation. So they're a really good point of contact too. Then when you finally reach the end of the visit, you know, you made your list ahead of time, you got to your appointment on time, you took notes. Make sure you guys do a quick recap at the end, because you always want to make sure that you don't leave until you know what testing that you're supposed to be doing. Do you have blood work too? Are you going to go for an MRI? Who's going to schedule those things? When do you have to have them by? And why are they being done? It's important to know what blood work we're checking and for what reason. Same thing with the MRIs. Why are we doing an MRI and what are we looking for? So have that plan and know what is going on and why it's going on. Make sure that you got those medication refills that you wrote down ahead of time, and don't leave without that, and know what the next steps are. So when are you supposed to come back for your next visit? I highly recommend you don't leave the office until you schedule that next visit. Even if you have to move it, at least it's in your calendar. And make sure that you know how you're going to, like I said, get to all of these things. Logistics are really important. And then you are going to ask how to best communicate with the provider between visits. So you've had this visit, you've scheduled your next visit. What do you do if something comes up between then and now? If you run out of a medication, if you have a new symptom, you need to know how to contact the office and what the protocol is for business hours, and both at night and on weekends, how you get in touch with people. Making the most out of your team. So this is when you start going to a lot of different specialists and providers, how do you make the most of your team? Because I'm sure a lot of you have realized that we're not always great at talking to one another or sending records, and there are a lot of actually like privacy laws that sometimes prevent us from forwarding records. So I always say it's really important to keep a copy of your records that you can bring with you to each provider's visit. So I always appreciate if somebody has labs done or testing done with their primary care, if they bring a copy of it to me. That way, if I don't have it, then we can at least look at it and I don't have to then hunt it down after the visit and call them back. And it just makes things a lot more efficient. And you're going to check in with each provider at least once a year in order to maintain the relationship, right? So we went over this, keep your foot in the door. That way, if you call and have a crisis, I can get you in sooner, right? A new patient visit, that waiting list at my office is currently 3 months. But I can usually get somebody in for a quick episodic visit the same week, right? So it's a lot less time consuming for us. You already have that relationship. You can call and get seen pretty quickly. And like I said before, a lot of the times, if we aren't sharing records among ourselves, probably because we don't have the authorization to do so. And that usually requires you to fill out forms at your doctor's offices saying it's okay for us to send your information, because of course your privacy is of the utmost importance. So we do need permission to do that. Promptly report new or worsening symptoms or troubling side effects. Don't wait till your next visit, right? And alert your team members to any financial or insurance issues you're having. So sometimes I'll have a patient come in and they're having more symptoms and, you know, the story isn't adding up, and I'll say, what's going on? Are you taking your medicine? And then that's when they'll tell me that they have trouble affording it, so they're only taking it every other day, right? And that's something I want to know right off the bat, because oftentimes I can work with you. I can plug you into copay assistance. I can help you out, find a foundation to help cover your medicine. I can prescribe medications that are less expensive. MS is an extremely, extremely expensive disease to have. So cost should always be on the forefront of our minds, but don't be embarrassed if your copays are too high, if MRIs are too high, right? We have strategies. I can tell you to comparison shop for your scans, because one healthcare facility might be significantly cheaper depending on your insurance company. So, you know, I think that's a issue that I address in almost every single visit. So if that's an issue for you, definitely make sure you're bringing it up.
So one real quick question, Stephanie. You said here to promptly report new or worsening symptoms. So how promptly? Do people need to worry that they have to call somebody in the middle of the night? Is the next morning good enough? What does promptly mean?
Yeah, so any new or worsening symptom that persists for over 24 hours, I want you to give me a heads up on. There are very few times when you're going to need to call your MS specialist at 3 in the morning. Most of the time it can wait, but sometimes if it's, say, we have Memorial Day weekend coming up, so many of us are out of the office for 3 days in a row. If you run out of a medication, or if you have an acute issue, or say you end up in the hospital or something happens, you do need to be able to get in touch with us. And so all neurologists have a way to get in touch with the team overnight, on weekends, on holidays. So you need to just know how to do that, and oftentimes you just call into the office. But definitely ask the receptionist on the way in, the way out, how you do that, just so you know. So again, when you're in a moment of crisis, you don't have to scramble. You have a plan in place, right?
Great. Thanks, Deb. I think we're ready for some questions and answers, Brian.
All righty. Thank you so much, Roz and Stephanie, for that great information. And thank you, everyone, for participating and sending in your questions. We do have time for a few questions, and if we don't get to them this evening, again, there are other opportunities to send in some questions. So by far, the most questions that we received had to do with communication. So first, a lot of questions about people don't feel like they're communicating with their specialist clearly, that how they're feeling is, and especially with invisible symptoms, is not being communicated to their doctor. So do you have tips on things they can do beforehand to really make sure that what they're communicating is clearly what they're feeling and meeting their needs?
Yeah, I think, like we mentioned before, having that list of symptoms and issues is great. But sometimes what really grabs my attention is when somebody says, I'm having bladder issues. And I'm like, yeah, you and everyone else, right? But when a patient says to me, I've stopped taking my kids to their baseball games because there's not a toilet nearby, and I'm missing out on that, and that's really important to me, that gets my attention. So maybe if you feel like you're being brushed off a little bit about the symptoms, or if that they're not getting addressed, really emphasize the impact they're having on you in your life, and be clear that your goal is to be able to get to those games, and how are we going to make that happen?
And I would just add to that I think it's really important to describe the intensity of a symptom that you're having. I was facilitating a support group once, and there was this young woman that we knew was in excruciating pain. She was telling us she couldn't bear clothing to touch her legs. She couldn't bear to sit in her chair. And finally, the group asked her how she presented the pain to her doctor. Do you look as calm as you do when you're talking to us? And she said, yes. And they said, well, no wonder nobody's really hearing you. You're not conveying that this is ruining your life day and night and feeling intolerable. So don't hesitate to give examples, as Steph said, and to really talk about the impact that a symptom is having on you and its intensity.
Yeah, and then if it's not getting addressed, don't be shy, get another opinion, or ask who you could be referred to for that specific problem, and build your team. Maybe that's what you need, is another team member brought in if you feel like it's not getting addressed.
And as you're building your team, a lot of people have questions on how they can get their different team members to communicate with each other. There's a lot of frustration that information isn't coordinated. Do you have tips on how to get the different team members to communicate with each other, or how to coordinate your information, organize your information so it's easily shared amongst the team members?
Yeah, as I mentioned before, I like everyone to have a copy of all the records so that you can bring it in to your appointments with you. And that way, I think faxing is great, and it's also incredibly frustrating because the patient will say, well, my primary care faxed me the blood work. Did you ever get it? And it's lost in the abyss. I have no idea where it is. I didn't even know that it was done. So it's useful if you have a copy of that. And like I said, always start by making sure that each office has the proper forms on file so that they can forward that information. I think that's the number one thing. And then, if something is of particular importance, often my patients will call and just say, FYI, I saw the gastroenterologist, he's doing a colonoscopy, and they'll just give me a brief update. I'll jot it in the chart. That way I know to either follow up with the GI's office to get a copy of that encounter, or I know to bring it up at the next appointment. So I always appreciate my patients taking that initiative to call me and say, this is going on. I just wanted you to be aware and in the loop.
And I think the reality is that some providers out there like being part of a team, even if it's a team that's spread out over the community. They like knowing that they're not managing MS on their own. So they welcome the opportunity to talk to the other providers involved with their patients. But some providers just don't. They feel they don't have the time, or they don't have the interest, or worst of all, they may feel they don't have the need to talk to anybody else who's treating their patients. So this is another situation where you might want to say, perhaps I can find another provider who's more willing to be a team player, because I know that good comprehensive MS care needs a good team. And I think you can find people, correct me if I'm wrong, Stephanie, but I think you can find people who are more team oriented.
Yeah, and I mean, that's the whole goal of comprehensive care, which is really becoming our focus. So, you know, if you can get to a comprehensive care center, because that is the whole model, or talk to other patients in your community. I know my support group in my community is extremely well informed about resources and how to plug into them. They have probably been to every specialist in town and can tell you who is doing a good job at comprehensive care and who's not. So that's another thing that you can turn to if you are frustrated and you've hit a dead end.
And another option you have that many people do is that they find whatever is the nearest MS comprehensive center to where they live, even if it's a distance away. Mm-hmm. And they go there maybe once a year or so for a full workup and consultation, and then take the recommendations from that comprehensive team home to their local neurologist or other providers. And MS comprehensive care centers are used to doing that. They do a lot of consults for people coming from out of town. So that's another way to get some of that teamwork working for you.
Great points. Thank you so much. Really great question that just came in. This person was wondering, going to the doctor and doing all the research ahead of time just takes a lot of energy, and with their daily pain levels and their daily fatigue, it's just impossible for them to even get out of the house to go all of these specialists. And so that sort of creates a vicious cycle that brings on more fatigue and pain. Any tips on kind of battling those issues with MS to be able to utilize that team but still manage the fatigue and pain?
Yeah, that is tough, and that's something that I hear a lot. So that's when I think it's important to bring in your support team. And if you do have somebody who can help you get to appointments and help you manage that fatigue, who can even just drop you at the door and pick you back up again, that does help. And if you don't have somebody to do that for you, a lot of times there are a lot of other community resources and things that you can plug into. But we do appreciate that it is tough, and unfortunately, not a lot of services can come directly to your home. That being said, we can get you physical and occupational therapy in your home. And a lot of times, like we mentioned with occupational therapy, they can help you manage that fatigue, and hopefully that would give you at least a little bit of help in managing that and being able to get up and about a little bit more.
Well, and I'm also concerned that this person is experiencing so much pain. You know, it wasn't that many years ago that people with MS were told that the disease doesn't cause pain. Doctors just denied that it was a symptom. And yet we know it's a very common symptom of MS. And I think it is, in most cases, possible to get it under control, although it might take some art and science combined to find the right medication or combination of medications. And so one of the things I would urge this person to do is really focus on that, getting some of that pain under control, working with a specialist, because then with that pain under control, it's easier to then do the other work that is involved in MS care. And as with cognitive changes, I would encourage anybody with severe pain to be have their mood evaluated, because when people are depressed, all symptoms feel worse, including pain, and then that becomes, of course, a vicious cycle, because pain is depressing, and depression can increase pain. So if you try to tackle that.
Yeah, and I think this is a really good example of how a comprehensive team is really important, but it can also be really overwhelming too. So this might be a person who just needs one or two really good specialists to work on those primary issues, like Roz mentioned. And then as we get those better controlled and as we get you functioning better, then we can work on expanding your team. But yeah, we do recognize that it is overwhelming at times.
And speaking of overwhelming, another question that we received, Stephanie, you mentioned that's a great idea to bring a support partner or family member to your office visits. This person is concerned that that could be overwhelming for their support partner, their life partner, and they're worried about how all these office visits will affect their family dynamics. Any thoughts on how to balance that, not overwhelming your partner, but still having them involved in the office visits?
Looks like Roz wants to jump in.
Well, why don't you go first, and then I'll because you're the one getting.
Well, I have a feeling that you're going to say what I'm thinking, and that is 9 times out of 10 when I do get a support partner or the family. Like, I love when kids come in, right? That's the best part of my job for me. I promise that I will not depress your significant other, that we will actually work and strengthen your relationship. It's a good time for them to see, the impact of your symptoms and what you do have to deal with, but also ask their own questions, because a lot of times that spouse or that support partner starts asking me, well, why does she have more symptoms when it's hot outside? And it's a really good educational opportunity that then you guys get to bring back home and can help strengthen your relationship, right, Roz?
Yeah, I agree with that. And I also think that while it can be feel overwhelming sometimes for support partners to hear about all the symptoms and to understand the complexities of MS, it's also overwhelming, frightening, and mystifying to be left out. Then they're left with lots of questions, lots of uncertainties, no opportunities to ask Stephanie their own questions and find out what's going on. So I think the best advice is to go together to appointments whenever you can, so that you go home each armed with information you need to work together to manage whatever these symptoms are and their impact on daily life. I think it's a win-win.
Yeah, I mean, it just opens communication, and I find the opposite is true, right? It doesn't build fear, it actually helps it.
Excellent, thank you. So now that you have this excellent team working together and you feel really good about your team, life happens and you have to move across the country. Any tips on relocating, or do you have to do the search all over again?
So I'm going to step in there, because I think one of the most common questions that comes in to the National MS Society's MS Navigators is, I'm moving, I need to find a neurologist in my new community. And the navigators are armed with information about providers all over the country, and they will be able to tell you where the closest MS providers are, who specializes in MS, who's a partner in care with the National MS Society. So it's definitely a resource. If you happen to be being seen in one of these MS comprehensive care centers and you say, I'm moving to another city, often your provider may know or have a colleague who works in the community where you're moving. So I think you ask your own providers, you call the National MS Society, and between them, you should be able to find somebody in your community. And along the lines of what Stephanie was saying before, don't wait till you get to the new community to call up and make an appointment. If it's going to take you 3 months to move, call now and set up an appointment for when you get there, so that you can become a new patient in that practice. And bring your records.
Bring your records. Bring all of your records. Bring your CDs of your MRIs, all of that with you. This is something I've had to do 3 times. My husband and I have moved at least 3 times to 3 different cities since I was diagnosed. And so I completely 100% agree with everything Roz just said. It does take planning, but you can have a smooth transition. And then if you are on a medication that is an infusion, especially Tysabri, that's an infusion once every month, and you don't want to get that interrupted. Oftentimes, reaching out to the pharmaceutical companies and the patient assistance programs is key. So actually not even just with infusions, because all of them are getting mailed to your house. So you also want to make sure that you reach out to them, make sure that they know your new address and where to coordinate sending your medication. Usually if you're moving, you're probably changing insurance too. It's either for a job or some other situation where your insurance might be changing. So make sure you keep everybody in the loop from that standpoint, so that you don't have any medication interruptions.
Great, thank you. Those are great answers. Another quick question. Someone is looking to get a new primary care physician. If the PCP is not directly experienced with MS, what are some other experiences or specialties that they should be looking for in a primary care physician?
I think, a lot of primary care doctors deal with people with chronic illnesses. So I get that question a lot. And while I don't have any specific primary care in town who is MS specialized, a lot of them see my MS patients, right? So my community is relatively small, but we still have over 1,000 MS patients. So inevitably, most primary cares are at least familiar with MS or other neurological diseases. And if it's something that you're not sure who to turn to, if you find a practice with a few providers, oftentimes you can call and say, who in the practice would you recommend for me? Because I have MS and I have other chronic issues. I didn't know if maybe there was a physician there who prefers that kind of a patient, right? So you can always reach out and ask.
Great. So I think we got time for one more question, and we have quite a few that have written in from rural communities and expressed some of the frustrations that we've spoke about before, just finding access to resources. And this person really relies on the internet to educate themselves on treatment options. To what extent should Dr. Google and the internet be part of that healthcare team, and what are some of the pros and cons, and at least starting that as part of your path and your journey?
So I think that the internet is a very, very valuable tool, particularly if you live far from a lot of resources. The trick, of course, is to know which sources you can trust and how to be an educated consumer, because there is a lot of misinformation or bad information on the website, on the internet. So I think your best guidance is to go to sites that are .orgs. So you're going to voluntary health organizations that aren't trying to sell you a product, like the National MS Society or the other MS advocacy organizations. Also, the pharmaceutical companies who make the MS drugs all have FDA-approved information on their sites about MS and about the medication that they offer, so you can get very good information from them. I think what you want to avoid is listening to a lot of testimonials from individuals telling their story or claiming that something cured them or was a miracle. You really want to go to authoritative sources. If something sounds too good to be true, it probably is. And anything that you do get off the internet, you want to try and check and verify with your healthcare provider as soon as you can before you make any big moves based on that information. I'm sure you have more to add to that, Stephanie.
No, I think you did a great job. I also just want to plug our next webinar because we dive into that topic in depth in webinar 2, which will be next month, which Brian will tell you all about, but that's a topic that we really hone in on next time too. So please come back.
That is an excellent segue, Stephanie. Thank you very much. Thank you, Roz and Stephanie, so much for that great information and our great introduction on our Path to Care webinar series. Thank you, everyone, for participating and joining us this evening. Apologize for the confusion with the polling questions. That was my fault. I'd like to let you know about some other great resources that are out there. As I mentioned, we really try to answer as many questions as we could. Obviously, we only have so much time, but we do have a program called Ask the Can Do Team. So if you go to our website, which is cando-ms.org, you can submit a question. We'll pass it along to one of our programs consultants and hopefully get you an answer to your question that way. There's also some wonderful webinars that Roz and Stephanie and many others have presented on, as well as some great library articles. We also do in-person programs all over the country. So you are now part of the Can Do MS family. So please visit our website for more information and programs and resources. And as Stephanie mentioned, this is part 1 of a 3-part series on our MS Path to Care webinar series. So you are already registered for our next program, which will be on June 5th, 2 weeks from today, and that will be on navigating healthcare resources. So visit mspath2care.com to see some of the other resources that we've created to share with you. And we will look forward to seeing you again on June 5th for part 2 of our 3-part series that you're already registered for. At the conclusion of this program, you'll receive a survey. Please let us know what you found useful from this program, what information you would have liked to have heard. That's how we make our programs better and better. And again, we really appreciate you joining us this evening, and we will see you again on June 5th with Roz and Stephanie, as well as Marquez Jones, who is living with MS and has some really great insights on how to navigate these different resources and how to be a great self-advocate. So Roz and Stephanie, any closing words this evening?
No, thank you all for joining us. It was great.
All right, thank you again so much. This will be archived on our website. You'll receive an email with the PDF slides, and we'll see you again on June 5th. Have a good night, everyone. Thank you.
Good night, everybody.
Night.